Good afternoon. My name is Dr. Petrikovsky. I'm professor of obstetrics and gynecology. And this is another update on the coronavirus infection and pregnancy topics. The reason that we do so frequent updates is because it's an absolutely new entity, both for the patients and medical community. Therefore, the new stuff comes almost every day. And I would like you to keep you aware of what goes on. The first positive news for the patients is that the governor of New York issued an executive order which mandates that all patients in labor and delivery may be accompanied by a partner. And that's a big change in the policy. And it's effective immediately. The partners of the patients that come to labor and delivery will be questions regarding the signs of coronavirus infection, and also their temperature will be assessed. And once it's done and the partner is clear by those tests and questionnaires, temperature test and questionnaire, they will allow to stay with the laboring women in labor. And that's a big relief for a lot of patients who were scared to be alone in a hostile sort of environment without a partner and in a general fear that goes on in the country. So at least that issue is resolved for now. The second issue I would like very briefly discuss with you is recent recommendations by American College of Obstetrics and Gynecology regarding pregnancy care. American College of OBGYN is very clear that prenatal care for essential appointments has to go on. And between us, in my opinion, doctor's office, those offices that are well prepared for coronavirus infection, in my opinion, are safer than grocery store pharmacies. And I'll tell you why. First of all, we practice telemedicine very often. Telemedicine does not only protect the doctor, but also protect the patients. Because doctors who go to delivery, participate in urgent surgery, are more exposed to coronavirus infection. Therefore, the use of telemedicine in many cases is a reasonable protection for both. Most patients, all patients actually in our office are pre-screened, temperature taken, and social distance is being observed in the office as well. All personnel is wearing protective wear, and you really don't need to convince people to do it because they protect themselves and they protect the patient. Thank you for your attention, and I wish you successful pregnancy.